Prolotherapy is one of the regenerative medicine techniques. I mean, we're in the future of regenerative medicine. In other words, we can now regenerate heart tissue. And as scientists and researchers and clinicians like myself use stem cells, various kinds of stem cells, that you're going to find all kinds of tissues, that are regenerated. I mean, hopefully eventually they'll find a way to regenerate spinal cord tissue and brain tissue and all these kinds of tissues. Prolotherapy's role is in the regeneration of connective tissues. So connective tissues would be tissues that are from the mesenchyme, and that's why we talk about mesenchymal stem cells. So mesenchymal stem cells can turn into cartilage cells, ligament cells, muscle cells, tendon cells, meniscal cells, labral cells. Technically fascial cells and other cells too, but those are the connective tissues. All those things are the connective tissues. So when you have a connective tissue problem and you need regeneration of the connective tissue, the injection technique that regenerates those structures, ligament tissue, tendon tissue, meniscus tissue, cartilage tissue, joint capsule tissue, that's prolotherapy. So prolotherapy is involved in injections that regenerate those structures. And we can use solutions as simple as hypertonic dextrose sugar, we can use sugar, or we can use hormones, we can use extracts of cod liver oil, or the newer techniques which are called autologous injection therapies. Autologous means that you're using your own body cells. So some of the cells that we can use are platelets that we get from blood. We can take the fraction of the blood that has the platelets, so that's called platelet-rich plasma injections or platelet-rich prolotherapy. And also we can take bone marrow cells. We can separate out the stem cells, or we can just use whole bone marrow. I like to use whole bone marrow because whole bone marrow means you're not only getting the stem cells and the other cells that are help with healing, because there's lots of cells that help with healing, not just stem cells. But because the stem cells live in the bone marrow, you know that it has all the nutrients that you need as well as all the growth factors. That's why I like to use whole bone marrow. We also can get stem cells from fat, from fat tissue. So that's called lipoaspirate prolotherapy. So prolotherapy involves, regular comprehensive or Hem-Wall-Hackett prolotherapy where we're doing a wide area of treatment at a time. We can do bone marrow prolotherapy where we're using bone marrow cells or stem cells, and then also lipoaspirate, we're using fat plus the stem cells and fat for the regeneration of connective tissues.